Well, a warm welcome to today's talk. It's Thursday, the 10th of June. I'm going to start off with some news from the UK, then the US, and we'll see how time goes and look at some international situations. India, for example, the death rate is currently very high, I'm afraid. Now, talking about India, the Delta variant at the moment in the UK, the India variant is now 91% of cases, according to Matt Hancock yesterday, and we can assume that he is well informed. So there we go. That is how quick this evolutionary process works. So the B117 UK Kent variant, what we now call what the World Health Organization called the Alpha variant, has now been essentially completely replaced by the Delta India variant. This can happen very quickly. And this is because of the great increased transmissibility of the Delta India variant. And we know it's increasing in the States now as well. So COVID symptom study data is pretty useful to look at here. Now, if we just have a look at this briefly on the screen, we've got prevalence 128,000 up. Then we can see the daily new cases, and this is the symptom tracker app. So these are symptomatic cases. So the real number of infections is higher than this, 12,891. And Tim Spector on his update does expect this to increase over the next week. That could easily be 20,000 next week. And there we see the prevalence increasing, and it does look for all the world like the start of a third wave. Now, this will carry on going up. That is, I think, quite inevitable over the next week or two. But I'm not overly worried for reasons we'll see in a minute. Concerned rather than worried, I would say. So the R value in the UK at the moment is 1.3. 1.3. Now, the Delta variant, according to Tim Spector, the R value is 6. So this means without lockdown conditions, each infected person would infect 6 others, and each of those 6 of those would infect another 6. So we have massively quickly exponential growth. But I was actually doing an interview yesterday with Professor Paul Hunter. Try and catch that interview if you didn't see it yesterday. And his data, East Anglia Medical School, says the R value for the Delta India variant could be nearer 8. I was taken aback, but that's his findings. So this is massive, at least twice as transmissible as the original variant. So the B117, which caused, of course, it's the B117 that caused this wave here. That's what that was this wave here, the increase in transmissibility of the B117 Alpha UK Kent variant. Then that went down, but now this is going up due to the India Delta variant. So this is the power that these variants have. It really is quite startling, really. Now, 2 doses of vaccine are going to be needed to give protection against the Delta India variant. So it's the young and unvaccinated that are going to be spreading it in the meantime. Cases could double in the next week, Tim Spector said yesterday, up to 20,000 per day. This is all from Tim Spector. So that's the COVID symptom tracker site there. That's Tim Spector's talk, which of course is excellent. Just click on the link, it will take you straight to it. Increased cases will feed through into more deaths, probably about 40 per day. And we know the reason why the deaths are way, way less than in previous waves, because of people being protected by the vaccine, and the people that aren't protected at the moment are mostly the young who get less severe disease anyway, on average, not always. Long COVID will also increase. Now, there's more on that in a minute. This is a bit of a problem. How much that will increase, we don't know. But this is becoming an increasing concern. Now, Tim Spector says that the cases for the last week or so, actually for the last month or so, since the beginning of May rather, have actually had a bit of a different presentation. It's presenting more like a common cold. So COVID is presenting more like the common cold. That means people often don't realise they've got COVID, so they carry on spreading it, and that's why we're starting to get the increase. Now, this has not been picked up by mainstream media. Imagine that, things not picked up by mainstream media. Sorry, shouldn't be sarcastic. We could have a long list of things that have not been picked up by mainstream media. They are very selective in what they choose to report, as far as I can see. Anyway, Tim Spector has reported this, and now I'm repeating it. Pity mainstream media aren't, but since May, headache is the most common feature. Sore throat is the second most common. Runny nose is the third most common. Fever is the fourth, and cough down to the fifth most common feature. So this is a change. So we see these as more sort of choroidal type features, probably representing mucous membrane infections. But the fever, of course, is systemic. The cough is more to do with the airways and the lungs, and the headache is a systemic feature, of course. Now, the anosmia, the loss of smell, which was such a prominent feature, not being reported now. So there's been a change in the symptomatology caused by, is it the change in the variant? Is it the change in the community immunity? Probably a bit of both. But interesting. So just remember that headache, sore throat, runny nose, fever, cough, any of those, self-isolate, get a lateral flow test. If that's positive, get a PCR test and follow guidelines accordingly. Now, what does this mean for opening up in the UK on the 21st of June? Well, the 4 government tests, the vaccine development programme continues successfully. It does. Tick. Evidence shows vaccines are sufficiently effective in reducing hospitalisations and deaths in those vaccinated. Not 100%, but pretty good. Infection rates do not risk a surge in hospitalisations, which will put unsustainable pressure on the NHS. Well, that test is actually met because although there is some increase, it's not unsustainable pressure. 4th test, the assessment of the risk is not fundamentally changed by new variants of concern. Well, I would think it probably is. So what will happen, what will be announced on Monday for the opening up on the 21st, we simply don't know yet. But technically the government is not, or the pandemic in the UK is technically not meeting the government's criteria for tests at the moment. The issue will be hinging around this word fundamentally. Is it fundamentally changed by the new variant or sub-fundamentally? Office for National Statistics, we commented on this yesterday, but there's more things. Now, they haven't updated the information on long COVID. It's the same as last week's. But basically, last week I was taken aback by how common long COVID is. So I'm just going to quickly review it. I expect the information to be updated by next week. But this is the same as last week's report. So as of the first wave, so we're talking about 2020, 1 million people were more than symptomatic for 4 weeks. As of the 2nd of May 2021, 376,000 of that 1 million were still symptomatic now. Well, as of the 2nd of May. So in other words, features lasting for a year. Now, of that 376,000, so presumably the rest, the 2/3 of a million, just under 2/3 of a million, got better between the 4 weeks and the year. But there's 376,000 still symptomatic a full 12 months later. Now, of that 376,000, 63.7% say they've got at least some limitation to the day-to-day activity. 18.8% day-to-day activities have been limited a lot. And this is most common in the younger age groups and less common over the age of 70. So interesting. Now, also from the Office for National Statistics, second vaccine dose, which is turning out to be so critical. Second vaccine dose, not that much, about 33% protection given against the Delta India variant from the first dose of vaccines, but going up to about 88% after 2 doses of vaccine. So important to get the second dose. So how are we doing with the second dose? Well, second dose uptake lower among all ethnic minority groups compared to white British population. Now, why is this? I really don't know why this is. Let me know. I really don't know that one. Overall, 70 years and older in England. So of the over 70s overall, for over 70s overall, 96 got the second shot within the 8 weeks by the 9th of May, which is the current recommendation. But to give a couple of examples given by the Office for National Statistics, people of Pakistani heritage in the over 70s, it was only 82.4% compared to 96% in the general population, and the Bangladeshi population 82.7%. So quite a bit less in these community subgroups. Tell me why. I really don't know. I mean, these are both Islamic traditions. Is that a factor? I really don't know what it is. So interesting. These are the ones highlighted by the ONS. More deprived areas, lower second uptake of the second dose. Numbers not given by the ONS, and disabled people, again, lower uptake of the second dose compared to people that are not disabled. Again, numbers not given. So Interesting things to try and explain there. Now, moving on to the United States, deaths are down by 90% since the January peak, so that's excellent. Late May, though, we've still got, and still now, late May it was 2,400 more than that deaths a week, mostly in the unvaccinated population. The main mortality group now in the States is 50 to 74. That's as of the Thursday, the 10th of June. So the over 70s have taken up the over 74s have taken up the vaccine 2 doses more effectively. So that's the highest mortality group now in the United States, 50 to 74, where of course it was the older age groups before that. Black and Hispanic populations lag behind the Asian and white populations. So Asian and white populations getting quite a lot of vaccine. Black and Hispanic populations lagging behind somewhat. Also, rural areas, homeless people, people who don't access medical care, also lagging behind in vaccinations. So if you're in the States, they're interesting things to think about. Now, talking about, we looked a couple of days ago in some detail on the status of hospitalisations in adolescents in the States. We've just been talking about deaths. I want to talk about multisystem inflammatory syndrome in children. Multisystem inflammatory syndrome, it can affect different systems in the body, like the respiratory system, the cardiovascular system, the neurological system. And it occurs in children. It's in the United States. 4,018 cases that met the criteria in the States, 36 deaths. Now, of course, 36 deaths is less than 1 per state on average, but these are 36 children. So this is important, and we have to have a high index of suspicion in children who are recovering from COVID for some weeks to keep an eye on them and get immediate medical help if we're worried about them, or parents or any significant people are worried about them. Early medical intervention seems to be the key there. So small number of deaths, but not insignificant. And of course, my mind goes to countries with poorer health care provision, where presumably a bigger chunk of that number of cases would transpose into deaths. Now, Moderna Vaccine, Moderna National Institutes of Health, requesting emergency authorisation from the FDA of course, it's been going for ages now, but this is for the adolescent group, for 12 to 17-year-olds. Also, Moderna's applied for the same permission to Canada and the European Medicines Agency. Authorisation by the FDA I can't see it not being granted, almost certainly. I'm like 99% sure it'll be granted from the data that we have. I mean, the trial data for Moderna and Pfizer in adolescents, I think it shows 100% of adolescents don't get symptomatic disease. And the safety and side effect profile is acceptable. So the Pfizer and Moderna seem even more effective in adolescents in preventing symptomatic disease than they do in adults. So that will almost certainly go ahead. The Pfizer's authorised already, of course, and about 7 million under 18s have already had at least 1 dose of the vaccine in the States. Now, there's a big powwow in the south of England. Is it in Devon or Cornwall? The G7, the group of 7, so people from like rich countries, America and the States, the States and the UK and stuff like that. President Biden's there at the moment, I think, and Boris Johnson, of course, is there. UK Prime Minister. So the UK Prime Minister is chairing it. So the world needs this meeting. Okay, we'll agree with that. We must be honest. International order and solidarity were badly shaken in COVID. Now, this is an interesting reflection, and of course, I think anyone who's watched this would agree with that. Nations were reduced to beggar my neighbour tactics. Yes, there was a bit of that, wasn't there? Desperate searching for personal protective equipment, for drugs, and finally for vaccines. So yes, it has been somewhat like that. If you're surprised, put your hand up now. Not too many hands up, is there? So unfortunately, this is not surprising. But being confirmed here by the Prime Minister, he says we should put those days behind us, which of course we all agree with. Is that going to happen? Well, The answer is, to some extent, it's starting to already, actually. So there is green shoots of recovery here, glimmers of sun through the cloud, perhaps. Anyway, the Prime Minister goes on, this is the moment the world's greatest and most technologically advanced democracies should shoulder their responsibility to vaccinate the world. Okay. Or I would prefer if it said to empower the world to vaccinate itself, but okay, as long as they get vaccinated. But no one can be properly protected until everyone has been protected, which of course we have been saying for a long time and we agree with. Now, on that note, President Biden, now this has not been formally announced by the administration yet, but we believe it's going to be announced probably by the time you're watching this, actually. So in other words, I prepped this on Thursday the 10th about midday, just before midday, early afternoon. And but by the time you're watching this in the evening or tomorrow, which would be my Friday now, he will have announced this. This seems to be the consensus of opinion. He's buying 500 million doses of Pfizer-BioNTech vaccine. I hope he gets a good deal on it because it's quite expensive. Not quite as expensive as the Moderna, but it's quite expensive at the moment. It's going to donate to 100 countries over the next year. Latin American and Caribbean countries currently getting 25 million doses this month, which they need. 80 million doses altogether going out this month. And we saw that there was 0.75 million doses going to Taiwan from memory, 750,000 doses. Now, the need in Latin America is still extreme. Now, we haven't covered this for a few days, but Argentina, Chile, Uruguay, the situation's still bad. So this doctor from the World Health Organization news conference, ITU beds are full, oxygen is running low, and health workers are overwhelmed in quite a few Latin American countries. So this is still going on quite badly. And when we live in countries where we're benefiting from the vaccination programme, we don't seem to notice as much. Right, India, they've messed up their accounting of deaths. So Bihar, northern state of Bihar, very poor, highly populated state. They've looked at their death figures and they've gone up from 5,500 up to 9,000, they believe now. But the article I was reading on this, it was New York Times actually. It said that at the best of time, India only medically diagnoses 20% of its deaths. So 4 out of 5 people that die in India don't have a medically diagnosed cause of death. And we know that the death rate in India has been massively underestimated. So this is just one state that's up to its estimate. And I would say even that, it's not quite a doubling. We have looked at evidence before that it's double or treble. The pandemic has hit India badly. Cases in India now going down, at least in the cities. So that's the case numbers in India going down, although we know there's limited testing in the villages. Remember, 65% of the population of India lives in its villages, and that they are even more underreported than the cities, although testing in the cities has gone up dramatically. So this could kind of balance out. So I think these cases are going down, but not as fast as this would indicate because of the undiagnosed cases in the villages. But the new daily deaths in India, they're the figures there. So that's the 6,000 line. So this is the adjustment in the figures in the Bihar, just because of the Bihar state reporting that the overall death figures in India, which did appear to be going down, have actually jumped up as they make that correction. So it means that the actual deaths in India have been, who knows, quite a lot higher, probably twice as high as that at least, unfortunately. And these pictures that we've seen of people dying without oxygen in India won't leave us readily. It's been a bad situation with shortage of resources. So just one more thing for today. Germany, vaccine confirmation app started today, and as of Monday you can go to a chemist or a doctor's and get your paper record put onto your vaccine confirmation app. Now I've got one from the NHS, and the day after my second vaccine it was on. No, two days after I think it was on. So I've basically got a vaccination status app. It's just that it's under the guise of my NHS app. So But this is the way it's going to go. Germany is just first. There's a European-wide scheme coming. It's called COVID Pass. There's just a QR code that confirms your vaccination status. And presumably, the Germans will have worked out that when you put it on your phone, that it's rather harder to fiddle than a piece of paper, because we can assume it's linked to a central database, and that is organised by the Robert Koch Institute, who are normally pretty thorough. So I think that wasn't too bad. That's what I wanted to say today, I think. So thank you for watching.